Hello and welcome to our special AGM webinar on workplace accommodation with Doug Kube. My name is Kathy Rambaran and I just wanted to thank everybody for joining us. We are very excited to have you all here today. At this time, I'd like to introduce Doug, our presenter today. Doug Kube has over 20 years of experience in occupational and public health, workplace safety, regulatory affairs, workers' compensation, disability, and risk management. As a senior consultant with Stantec, his principal area of practice is workplace safety, health and productivity, risk management, corporate governance, and auditing. Doug works with clients to identify and prioritize risks and to help them understand the human and social economic costs of disability. He works with employers to develop programs that maximize savings in averted regulatory fines, reduced workers' compensation and disability costs, leading to improved employee health, satisfaction, engagement, productivity, and performance. So please join me in welcoming Doug, and I'll pass it over to Doug at this point.
Thank you. Thank you for the opportunity to speak today, and quite honored that you've asked me to speak at the AGM. What I do today is to share with you some of my experience and perspective around the issue of work accommodation and integrating the knowledge and the experience that I've had, and hopefully to inform some of the decision-making practice and research that goes forward. My perspective is really from sort of three main areas. Number one is as a director responsible for occupational health and safety at both Purolator Courier and last few years at Air Canada. So I've had experience in those positions trying to re-engineer and develop work accommodation, return to work, health and safety programs. The second perspective that I'm bringing is now that I'm back into consulting as a consultant, and having last year worked with several clients to help them to evaluate what their approaches are like, or what their approaches are, and what's been working, and where there are opportunities for improvement. And then third perspective I bring on this is having been a director of the CIRPD and working with Mark and the others, and have learned a lot in this area that the CIRPD has been working on in research and trying to disseminate some of the research that's been done. So as my outline shows here, I'm going to talk about the past 10 years, what we've seen in the past 10 years. As I said, a lot of my perspective is from the front line and trying to ensure we have programs developed to accommodate people in the workplace. I'd like to talk about some of the factors that we've identified over the years that contribute to success, and planning, implementation, engagement of stakeholders, which is a critical component of any work accommodation program. I'll share some information on evaluating some of the interventions that we've seen, and lastly speak quickly at the end about sharing the knowledge, which I think is a big area of opportunity, particularly with what's planned with the CIRPD and the Health and Work Productivity web portal. I'm excited about that. So we go to the next slide on impact of work disability. I think it's important that you lead off any presentation on work accommodation or return to work or disability management to keep in mind the impact on the worker, on the individual. It reduces. We know that it reduces quality of life for the individual. Situations where a worker may be injured or ill and may not be back at 100% can be very difficult. Can impact negatively on the family. It can also result in issues within the workplace. I think a lot of it, what we see, is based out of fear or lower self-confidence of the individual. It can result in impact on morale of other employees. And it ultimately leads to economic burdens for the employer and the employee. And also, when we talk about the accommodation and bringing someone back into the workplace, often leads to issues around work exclusion and trying to ensure the employee feels that they're valued and being brought back in the workplace. And also, lastly, negatively affects the organization's most valuable resource, and within organizations today, there are many leading organizations that are looking at it more from a human capital perspective, and we're realizing that disability reduces the organization's human capital. And this concept of human capital is an interesting one because it raises the issue that the only capital in an organization that has the ability to appreciate is a human capital. When all other physical capital depreciates, we have a valuable resource in a human being to be able to appreciate and grow as an individual and support the organization. And next slide. And when we looked at the past 10 years on work accommodation, one of the things that I sort of did a retrospective look and thinking about 10 years ago when I really entered into this. If you can go to the next slide. So just thinking retrospectively, and I was sort of sat back and said, where were we 10 years ago? You know, one of the things we realized is 10 years ago, accommodation wasn't what it is today. We were more focused 10 years ago on accommodation as it related to hiring practices, those who may be physically disabled, or accommodating religious freedoms. It's come a long way in the last 10 years. 10 years ago, a lot of the return to work programs and accommodation that was happening was driven by the Workers' Compensation Board, and we had a real legalistic focus to adjudication, focusing on things like fraud identification and management, a reliance much more on the medical as opposed to functional and looking at job demands. 10 years ago, employers really lacked an understanding of their disability costs, and I think we've come a long way in that area. But I recall 10 years ago having discussions with senior people in organizations who had no idea what disability cost the employer. And lastly, the policies and programs were probably more focused around implementing things like EAPs. There was a move at that point 10 years ago to start looking at individual wellness programs, a focus on time and attendance. And then we started to see the emergence 10 years ago of issues like presenteeism. It began to emerge as a new business issue, as well as workplace stress and mental health was emerging as a real issue from an HR perspective. Next slide, please. And if we think about 10 years later, as if today, I think one of the things that we've been fortunate to see is some progression or some improvement and a real shift in many organizations who are trying to accommodate individuals from the medical-only kind of model to incorporate functional abilities and address issues like social limitations and ergonomic issues. The issue of duration is a big one for organizations, for employers. We're starting to realize, I think, today that duration is significantly reduced by accommodation offers and having effective interventions to support the individual. And that duration is also reduced by early contact with the worker by the employer and the presence of resources such as a return-to-work coordinator. And many of the clients we work with today are really, if they're not at the point where they have someone coordinating the return-to-work process and the accommodation, they're realizing the need. I think, too, the other issue that's come up is that we need to, accommodating with productive duties and consistent with the functional abilities that reduces costs not only to the organization, but costs that are borne by the individual and by society. And that workplace stress today, I think you can see, I talked about workplace stress and mental health issues evolving 10 years ago, starting to evolve. Today, workplace stress, work-life balance issues are a major source of impairment. I think if you look in most organizations today, the category that's at the top of the list is around workplace stress, mental health, work-life balance types of issues are the ones who are driving a lot of the disability and a lot of the costs. And one of the issues that's emerged a lot, particularly in the past couple of years, is privacy. It's probably one of those issues that we need to keep an eye on over the next couple of years because it's risen up as a major issue. The impact of the economic slowdown is something I wanted to throw in today to talk about because I think we're in the middle of a recession. We're going to probably, from the economic indicators we see, we're still concerned that we're not coming out of this recession, if it is a recession, but there is clearly an economic slowdown. But there's some interesting research that's come out of Towers Watson in their Staying at Work report that shows that higher rates of unplanned, there are higher rates of unplanned and disability-related absences in the past year or so, and we think maybe linked to the economic slowdown. We're seeing a higher incidence of disability claims and increased use of programs as well, in particular programs like EAPs. That's the bad news. The good news is that we're starting to see more use of the medical and pharmacy benefit programs. Hopefully that's supporting and helping employees, and that we seem to be seeing that organizations are more committed to health and productivity investment, and that more selective, probably more strategic approaches and programs seem to show some evidence that they're resulting in a better return on investment. So I think we're starting to see that organizations are not taking the shotgun approach to it anymore, that they are being very selective and trying to seek and implement programs that are very targeted to the kind of disability and accommodation issues that they have. The next slide talks about changes in business leaders, and you know, one of the things I would say in my experience in the past 10 years is that, you know, I think business leaders are starting to take a real hard look now at issues of workplace health and disability. I think most CEOs and executives today are starting to see that employee health and disability is inextricably linked to the profitability of the organization. It's become an issue at the boards of director level. I know my experience at Purolator, even in 2002, 2003, there was an issue that was talked about regularly at our board, and I think most boards are starting to realize it's a risk that needs to be managed. And I think the attitudes, too, have changed, that it's no longer a cost of doing business. It is something that we can manage. It's something that needs to be managed. And I think, too, on a positive note, unions are starting to promote or continuing to promote that accommodation is a fundamental right, and unions are recognizing, you know, their role and responsibility in supporting their members. And that's an exciting opportunity, I think, if unions continue to grow and develop in that area. They're going to continue to provide leadership in that area. And I think a lot of senior members, too, or senior management are starting to recognize that addressing some of these health and injury risks and disability risks are going to be required if they want to address the trends of absence, benefit costs, and improving financial outcomes of the organizations. We're seeing that we're seeing some progressive organizations where there's CEOs, CFOs, and senior VPs of HR that are really starting to examine how to control rising health care and disability and lost productivity costs. But I think the positive thing out of it is they're seeing that there's a real need to invest in their people, invest in the workforce, and that, to me, is an exciting change in business leaders. I think they're starting to see the business case for putting more money into programs for their people. One of the issues that I mentioned here, the linkage between health and productivity, again, I believe that we're starting to see that senior management and leaders within organizations are really recognizing the link, and that the research that came out of Towers Watson and their Staying at Work report, some of the more recent research was really interesting, that has shown that companies with the most effective health and productivity programs, those health and productivity programs, they tend to experience better human capital and financial outcomes. So when they compared organizations that had more effective health and productivity programs to those that had no or less effective health and productivity programs, the ones who had the better programs were experiencing a higher revenue per employee, fewer days absent, 28% higher shareholder returns, which, as many of you know, from a business perspective, is something that's a very important key performance indicator. And more likely to have lower healthcare costs, lower presenteeism, fewer lost days due to disability. So I think that there's a recognition now that we need to invest in things like accommodation. Next slide talks about the cost of accommodation 10 years later. As I said before, I think employers have really started to learn and to develop a better understanding of what costs exist. And secondly, they're recognizing that accommodation strategies help to control the costs. And I'm not just talking about the financial costs. I think we also have to recognize that we're seeing that accommodation helps address costs to the injured worker or the ill worker as costs to society, and not just the financial costs, but the human costs as well. And the companies report that cost of accommodation, accommodation costs are what appears to be somewhat lower, 0.5% lower in terms of payroll costs. What I'm saying here is that there appear to be, in some of the research that we're looking at, that we're seeing a bit of a decrease in the past few years. And if we look at some of this work that was done probably 3, 4, 5 years ago by, at that time was Watson Wyatt, typically we were looking at the cost of accommodation being around 1%. So there's some suggestion that we're seeing maybe more effective approaches to accommodation, and that absenteeism and disability management costs as a percentage of payroll have reduced as well, which is quite interesting considering a lot of the research suggests that we're seeing increased lost days or increased number of claims in some areas. But I think there's some good news there in that we're seeing a decrease as a percent of payroll. So to switch gears somewhat now and talk a little bit more granular and maybe more down at the front line, one of the things we're seeing is that many of the challenges as it relates to accommodation seem to trickle down or get pushed down to that frontline supervisor or manager to help support the accommodation process and work accommodation. And we're seeing that communicating and working with the primary health care provider is a real challenge for those frontline managers, and that some of the research that we see suggests that the likelihood of return to work is reduced where there is a high degree of difficulty with dealing with or contacting the physician. So I think that's still a challenge for many employers, and in particular at the manager level, and particularly smaller employers who don't have occupational health departments with nurses and doctors. When they have challenges contacting physicians and healthcare providers, they are challenged to try to reduce try to get people back to work. Another challenge that many employers have at the front line is that accommodating people in a job that is available, productive, sustainable, and restores the worker's pre-injury earnings. There are challenges in identifying duties that are consistent with the worker's functional abilities. The manager's lack of understanding of the true cost of disability. I think many organizations, when we go into organizations and talk to managers, they really don't understand the cost benefit of focusing on helping to accommodate individuals. And I think supervisors in many organizations lack an understanding of how to accommodate individuals, so the process and what their role as a manager is to accommodate an individual is. So those are some of the challenges that we typically see in the employer side. When we look at the worker side, one of the key challenges that we continually hear from workers is the challenge of trying to reconcile what their physician's opinion is, what their employer's accommodation offer is, and what the board's decision is. So many times we'll see an employee who comes in saying, you know, my physician says take a few weeks off or take some time off, where you've got an employer who's saying we're making an offer to accommodate you, here's the offer, and then the board may have a different opinion as well. So the employee is somewhat caught in the middle in many of these situations. Also, there's some challenge around, I think everybody knows this, accessing appropriate care, challenges in getting in to see a specialist. There are delays in the system which typically delay their ability to return to work and be accommodated. Challenges in maintaining a level of comfort that what they're going to be doing when they are accommodated back into a role in the organization is still safe and keeping them healthy. Workers quite often express concerns around, you know, how do I request an accommodation? What is the process for to returning to work? And one of the biggest issues I think that's at the root of a lot of this is what we're hearing is the perceived employer support is a critical element. And the research suggests that there's a reduced likelihood of return to work when the perception exists that their managers are not really employee-focused or supporting the employees, or that there's a diminished social status if they return to work, or that they're going to be scrutinized on their claim or their entitlement. So I think there's some more research that's come out a few years back around employee engagement that also supports this, where they looked at the perceived organizational and perceived supervisory support as being a key antecedent to improving engagement in the workplace, and so this really supports that research as well. One of the challenges that we've talked about is the connection with the family physician, and I wanted to try to talk today a little bit about how do we create more effective linkages. And I think too, what you have to recognize from this slide is the family physician or the treating healthcare provider is at the center of this issue right now, with not only having to deal with the employee or their patient, but they're also pulled in many directions because there's an insurance carrier or a workers' compensation board that is looking for information or forms. There's a family members who may be involved in looking for answers. The union may get involved and be trying to connect with the employee or with the physician to advocate on behalf of the employee. The family physician or the treating physician is trying to deal with the other allied healthcare professionals, particularly when we look at physio or in the mental health claims in terms of dealing with helping them individuals with support that may be available in the community, and ultimately the employer. And if you push the next button and bring up the next graphic, that we have to put it in perspective that the physician's being pulled in a lot of ways, and the employer is only one of the parties who's looking to connect with the physician. And then when you look at the employer side, there are a lot of facets to this issue where the employer is trying to prevent work disability. They're trying to manage those who may be injured or coming in and reporting an illness. They're trying to support more broadly in health with benefits programs. They're trying to implement wellness programs. And also one of the keys that keeps coming up around this issue of accommodation and engagement is culture. They're trying to, or some cases maybe need to try to, improve their culture, and that ties back to what I talked about earlier in ensuring that there is organizational and supervisor support and coworker support for folks who experience a disability. So that connection is a really important one. One of the factors, when we look at factors that contribute to success, I've looked at some of the research and sort of thought about what we've done over the past 10 years, some of my experience at trying to re-engineer the system at Air Canada or putting new programs in place at Purolator, and some of the clients that I've been working with, and we kind of narrowed it down to a handful of, I think, were really important success factors that contribute to improved work accommodation. And one of the first ones is, I think we all are starting to come to the recognition, and at least the boards have, workers' compensation boards have, that return to work needs to be done in an early or timely and safe manner. That early contact with that physician and the employee, or sorry, the employee at first, and effective communication and intervention supporting that employee is really critical to success. And something, as I said, that's really evolved over the past 10 years is the need to start looking more and focusing more on objective functional abilities to assess levels of ability or disability, as opposed to focusing on the medical only. Also, one of the key factors, I think, is returning all employees irrespective of their compensation or benefit, meaning we still see organizations today who save modified jobs for those who are on workers' comp, but may not offer an accommodation to those who are on sick benefits or short-term disability or long-term disability. And that's an issue that I think really needs to be addressed in organizations. Standardized approach to return to work and case management processes is something that I see a lot, that we still have a long way to go in terms of standardizing the process. although we understand every case and every individual is different, there needs to be work around standardizing the approach and process so that we're fair and equitable to all employees. And lastly, one of the factors that we believe contributes to success is having trained return-to-work coordinators supported by occupational health professionals. And again, there's some research that suggests that the duration is significantly reduced by contact between the healthcare provider and the workplace. And that really is done through the conduit of the return-to-work coordinator and occupational health professionals. So that's something we've seen utilized very effectively. When we look at other success factors, some of the things we see is the use of ergonomic site visits to assist in accommodation can be really effective at helping to accommodate individuals. Involving the stakeholders in the policy development or the development of your program up front is critical. I believe very strongly that the union and other stakeholders need to be involved right up front in the design and the development of your policies and your programs, not necessarily saying other stakeholders such as union representatives need to be involved in every case, but they should at least be involved in the design of the program. And that we seem to see some research again that supports that union involvement in the process is associated with an increased likelihood of return to work. And as I said here, issues of fairness and trust are at the core, at the root of a lot of the success that we see. And that consensus on the processes, the forms, and defining expectations and roles is really important from a stakeholder perspective. I can share many stories of organizations, particularly unionized organizations I've worked with, who struggle when they can't agree or can't find consensus on what the process is to begin with. Also, key success factors include standards and evidence-based approaches or evidence-based systems for service providers. We still see an awful lot of service providers out there who may not be up on some of the latest research and understanding. So I think it's really important that for organizations who are using service providers, whether that be someone who's managing claims, managing cases, occupational health and medical types of services, that there are standards that exist that probably need to be disseminated better and communicated. And also one of the success factors that we've seen is the use of hierarchy of return-to-work choices, with the preference being starting with the pre-injury job and then looking at alternative jobs. And also, lastly, integration. I think within organizations, one of the things we've realized is that the better you can integrate your accommodation processes with attendance management and some of your labor relations processes and your prevention, safety prevention programs, your wellness programs, the better, the more integrated it is, the more effective they tend to be. On best practices, one of the things we've seen is that look at leading employers who have really good work accommodation and return to work processes. They tend to have a comprehensive approach to managing time away, meaning not focusing individually on just the workers' comp cases or the sick days, but a more comprehensive approach. They have consistent policies that are developed with all stakeholders. They have elements of disease management coaching. They have resources to support individuals through some of the issues they're dealing with their disease. They have programs to try to avoid discretionary time away from work, meaning the allotment of sick days that you can use regardless of what the reason is. We tend to see leaders have in the field have comprehensive methods for measuring as well, and I think that's a really important point, that if they can measure lost days, they integrate some of those measures with absence management and disability data, health plan data through healthy workplace or wellness initiatives. They really have a better picture and understanding of their accommodation challenges and their costs and what they can do better. And leading employers tend to audit or evaluate the effectiveness and the compliance of their program. One of the things we've been doing at Stantec right now is working with some clients to audit their programs. auditing what they're doing from an accommodation perspective to verify that they're compliant with the human rights legislation, with workers' compensation legislation and policies. And, you know, so there's a compliance component, but also to try to audit and verify the effectiveness of the management program as a whole. And lastly, leaders tend to have mechanisms to report up through the organization on the effectiveness of their accommodation investments, not only to senior management, but the leading companies we've been working with also have a mechanism to report on health and productivity issues right up to the board of directors. One of the key issues, and I think all of you know this, is one of the big issues that we struggle with today in accommodation is accommodating individuals who have mental health concerns. And one of the things that we've seen is that this has been evolving for some years, but you know, we're starting to see that there are some best practices out there. And some of the examples and the interventions that we've seen that seem to be effective or that need to be considered are things like flexible scheduling, part-time scheduling, and more frequent breaks. Again, 10 years ago, those types of interventions or suggestions to organizations wouldn't fly. I think today, with mental health issues as they are, we're starting to see organizations who are becoming a little bit more flexible in those areas, and that they're looking at things like a flexible leave program or working at home program, job sharing programs, restructuring the job to focus only on essential duties. And these are the kind of things that can effectively be used in accommodating individuals. Also, one of the, I believe personally that one of the biggest areas that organizations need to focus on is focusing on their frontline supervisors and managers. And what we've seen is organizations who have worked with their frontline managers and supervisors tend to be able to tend to have better success because managers and supervisors understand the importance of positive praise, reinforcement, creating a positive culture in their area to support the individual with the mental health issues, and also providing those supervisors with the tools they need, such as written work agreements that provide clear expectations that the parties can sit around the table and agree on. And co-workers, I talked in the beginning about the alienation that may happen with some workers. One of the areas that everybody needs to look at is, you know, what is happening within the workplace with co-workers. And leading companies who are putting the right interventions in place tend to focus on educating their employees on some of these issues, on the kinds of issues that their folks are dealing with, on their right to accommodation, and also tend to work with, develop programs for co-workers to either partner up or pair up with individuals who have issues, or create mentoring programs to try to mentor individuals who may have interpersonal skills, apps that they need to develop. The I mentioned earlier that I would talk about the Health and Work Productivity portal. I'm excited about this because, you know, in this presentation I've included some of the you know, thoughts that we have and some of what we've learned, and I've also included some of the early findings of the research project that was funded by WorkSafe BC to help us to pilot the CIRPD's web portal. I think this project, being a collaborative project that is involving academic scientists, community stakeholders, I think is really going to pay off. We're starting to identify high-quality research and translate that research across different stakeholder groups involved in disability prevention, disability management, and work productivity. As I said a couple of times in this presentation, I think the research exists to support a lot of what we need to do in improving accommodation in Canada. And one of the biggest opportunities is disseminating that research and putting it into practice. I think I'm convinced that this will assist the stakeholders, and this portal will assist stakeholders in identifying the credible resources, helping to facilitate safe, healthy, accommodating, and productive workplaces. And as I've said early in the presentation, many leaders are starting to recognize the link between health and productivity, and that the practical implementation tools and resources that we can provide through this portal, I think, will be great to help as a one-stop shop, or one-stop practical guidance portal. We can provide a location for folks to go, practitioners to go to look for information and tools that they need to help. And lastly, I'd say on the portal that we really are excited about this, and I'd invite stakeholders and other stakeholders to join us on this project, because we're nearing the point of the next phase, and we're going to be doing the beta testing, and I think there's now a real opportunity to help and to be part of something that's pretty exciting here. The next slide, I'll talk quickly about remaining barriers. There are still many barriers that exist. I think one of the biggest barriers is that there are leaders and there are less sophisticated employers out there today, and I think we need to disseminate what leaders do and create more sophisticated practices in organizations that are trying to accommodate individuals. I think there are also opportunities not only to disseminate best practices, but also to look at the link between what is being done in academia and some of the other stakeholders' interests and needs. And probably one of the biggest areas where we need to address is that primary health care provider, the treating physician knowledge, their participation in work accommodation. And I think, as you've been able to glean from my presentation today, I'm a strong believer that the primary health care provider is key to early, effective, and safe return to work, and that training and helping them to understand disability prevention and disability management is going to be critical going forward. And we need a more systematic, evidence-based approach to primary care renewal. We need to help the medical field, and primarily the treating physicians today, to continue to grow and to develop their understanding of what needs to be done. I also see a lack of standards for insurers and service providers, and I know there's been some work being done in this area, but one of the areas I think we still have a ways to go is to ensure consistency through standards. And I think, again, everybody probably recognizes accommodating mental health concerns and chronic diseases as well is a huge issue in accommodation. There are some interesting parallels with what we're seeing in issues like chronic disease and some of the research that is also being done on the aging workforce. So I think there are some solutions that are going to help with both chronic diseases as well as aging workforce issues. And I think, too, that lastly, we're lacking research on the interventions. We have limited details to provide us with the confidence that the interventions being offered today are truly effective, and I think there is a need for more research on process and intermediary variabilities. That's my presentation. I'd just like to conclude by saying thank you again for allowing me to present, and happy to take questions. And just to reiterate what I said in the beginning, I really truly believe we've come a long way in the past 10 years, but I think it is an area where we have a lot more opportunity if we're going to try to reduce the impacts on individuals and to help create better work accommodation processes and outcomes. Thanks.
Thank you, Doug. That was very interesting. This is Anne speaking, and I was just checking to see if any questions have been raised so far, and people may have a chance now through their question panel to ask you any questions. And of course, we have people here in our live audience who are welcome to ask questions too. I do have one, which is, are you seeing trends towards change in your province or worldwide?
I guess my knowledge is limited really to North America, but I think we're seeing trends of change, at least in Ontario. We're seeing some pretty significant changes are happening in WSIB here in Ontario. I think we're seeing some pretty significant changes in some of the employers in terms of their approaches. I've dealt a lot in the past 10 years with British Columbia, Alberta, Quebec, and out east and other provinces, and I think we're seeing trends of improvement across all provinces. It's pretty consistent. Some interesting research that comes out of Towers Watson that suggests that Canada seems to be, the trends in Canada seem to be somewhat ahead of the U.S. And I think I tend to believe that. I think the U.S. is maybe going to be playing catch up with Canada a little bit more. I can't really speak about outside of North America because I haven't really had much experience with that.
Okay, I have another online questioner, and the question is, what do you think about physiotherapists providing primary care for musculoskeletal injuries within the WorkSafe context versus the current practice of having physicians as gatekeepers?
I think it's a huge opportunity. I really believe that you know, with what we're seeing today in terms of what I talked about, some of the barriers and some of the difficulties in trying to educate the primary health provider in speaking about physicians, I think it's time that you know, we look at physiotherapy and other interventions and determine ways of involving them earlier, taking on that primary care role in a bigger way. I'm a huge proponent of it. I've had some experience with some pilot programs that we ran at Purolator, where we had a couple of different pilot programs, one running with physiotherapists and another interesting one running with athletic therapists, and involving them early in the process. And the results that we found out of those pilots were terrific. They not only, we felt, helped reduce duration per claim, we think these interventions helped prevent lost time claims, and the exciting part for me too was the feedback from employees was fantastic, because the injured employee or the ill employee felt that they felt that the company was taking an interest in their rehabilitation, and that it wasn't a hands-off approach of go see your doctor and come back when you're ready. So I think that there's a huge opportunity in that area of physiotherapy, and also on the mental health side in terms of getting alternative healthcare providers to get more involved with very early on and taking charge of the case.
And I just wanted to add that the evidence to that is that there's a lot of research to show that chronic disease or injuries that turn into chronic disease are handled successfully with multidisciplinary approaches, not just one physician.
Absolutely. I think the challenge is, as you said, whoever was asked the question about, challenge quite often the gatekeeper who we rely on to link to the multidisciplinary team, and I think that's become a barrier in so many cases.
All right, yeah, we have a question here in the audience.
And an extremely interesting presentation. I like the optimism and the solution orientation.
I'm sorry, I've lost you. I can't hear.
Okay.
We have to do some distance here in the audience, so he'll be right here.
Okay.
Thanks, Dan. Ken Craig here. Most appreciated the presentation. I enjoyed the scope. I found it interesting. I enjoyed your solution orientation and optimism. I had a couple of questions. First of all, I'm wondering about the centrality of pain to the issues that are involved. Is it worth emphasizing pain as a source of disability?
Yeah, yes, absolutely. There's, you know, my experience in terms of having run programs and again as a consultant, quite often chronic pain, issues of fibromyalgia, pain issues as simple as I said with the pilot we were running at Purolator with the athletic therapists, quite often what they were dealing with is helping individuals who had pain from very physically demanding work. I think, pain is clearly a source of impairment and is probably not well managed in many cases when it comes to accommodating back into the workplace. And I think too often what happens in the workplace when you're trying to accommodate an individual back is the workplace tends to try to medicalize the claim and is less interested in what creative solutions or creative ideas they can come up with to accommodate the individual's pain and help them manage their pain. So clearly I think it's an issue or a source of impairment, but often it's very challenging from a work accommodation perspective.
Well, thank you. And I wanted to broach another area with a question, and I enjoyed the brief comments on sort of an economic analysis, the relationship between health and productivity and the cost of accommodation. And I'm wondering, is there some kind of a trade-off between increased productivity and increased programs of the type that you're describing? In other words, investing in programs focusing on accommodation, to what extent do they have payoff in terms of any of the indices of financial outcome that you've described?
Yeah, I haven't, well, other than perhaps the research that's been done by Towers Watson, and there's some research there that supports that investing in health and productivity programs will help to improve outcomes or reduce costs. So maybe this is an area of opportunity from a research perspective, something that needs to be researched more. I guess anecdotally and from my experience, the success I've had at both Purelator and Air Canada, a lot of it was built around the idea that if we invest in our human capital, we invest in improving the way we support our employees, and we invest in accommodating and bringing people back to work in a timely manner, a safe manner, that there is a payoff. And I've, at least for those two organizations and a couple more, it's been very easy to prove to the bean counters of the CFO of the organization that there is a very quick payback for putting investment into accommodation programs, and it's something that can be, I think, relatively easily demonstrated when you look at it from a very simple cost-benefit analysis perspective of looking at what it costs you to accommodate an individual versus what it would cost you for that individual to remain out of the workplace on workers' compensation or some other sort of disability benefit. And one of the key drivers of cost for employers, and I touched on this a little bit, that a lot of employers don't even realize what the costs really are. One of the things that most employers don't recognize is that they are probably paying somewhere between $2 and $10 of indirect costs for every dollar of direct cost that is being paid out on the claim. So when you think of it that way, it's very easy to build a business case to say that we should be investing more in accommodating individuals in the workplace, and that there's a clear financial benefit for the organization if they do so.
Thanks, Doug.